Hi, this is Isha, and I would like to welcome all of you in today's Cell Talk webinar. In today's session, Yogita Das will be presenting the paper titled Association of Early Immune-Related Adverse Effects with Treatment Efficacy of Neoadjuvant Toripalimab in Resectable Advanced Non-Small Cell Lung Cancer. Yogita is a clinical writer at Renix. She is responsible for writing scientific content and clinical white papers on health-related topics with the main focus on oncology and immunology. Yogita has a doctoral degree in life sciences from Symbiosis International, Pune, and her research work focuses on diabetes and vitamin D. At Renix, she has gained experience in scientific writing. So, without any further delay, I'd like Yogita to carry on the talk.
Thank you, Visha, for this brief introduction. As a part of Cell Talk activity, today I am presenting a research on association of early immune-related adverse events with treatment efficacy of neoadjuvant toripalimab in resectable advanced non-small cell lung cancer. This paper has authored by Tao et al. And it has published in the journal Frontiers in Oncology in the year 2023. The journal has impact factor 4.7, and this research has impact on the lung cancer and the type of lung cancer, that is non-small cell lung cancer. Lung cancer, it is the leading cause of cancer-related death in India and also worldwide. Lung cancer happens due to the uncontrolled proliferation of the cells in the lungs. It is mainly categorized as small cell lung cancer and non-small cell lung cancer. Small cell lung cancer, it is less common. 10 to 15% of the cases are reported with this type of the cancer, and it grows slow, it grows rapidly and spread rapidly as compared to the non-small cell lung cancer. Whereas non-small cell lung cancer, it is more common. Almost 80 to 85% of the lung cancer cases are of this type, and it is further categorized into three different subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. In this figure, we can clearly see the difference between non-small cell lung cancer and small cell lung cancer. This research has focused on the non-small cell lung cancer, which is treated by various different treatment options such as surgical resection, radiotherapy, chemotherapy, targeted therapy, immunotherapy, and other advanced therapies. This research has focused on the immunotherapy. Immunotherapy uses patient's immune system to fight against the cancer. There are various forms of the immunotherapy. The immune checkpoint inhibitors, it is the most commonly utilized immunotherapy in various cancers, especially to treat the patients with the advanced type of the cancer. Here, immune checkpoint inhibitors like anti-PD-1, that is which blocks the interaction of programmed dead protein 1 with its ligands. It is mainly used to treat some patients with advanced type of the non-small cell lung cancer. In many clinical trials, they have reported that immunotherapy exhibited some immune-related adverse events. These adverse events may be more likely to achieve pathological complete response after the commencement of the neoadjuvant immunotherapy. These adverse events occur due to the activation of the T cells, which helps to kill or eliminate the tumor cells. In this paper, they have used the immune checkpoint inhibitor toripalimab, which is a selective recombinant humanized monoclonal antibody. It blocks the interaction of PD-1 with its ligands, that is PD-L1 and L2, which further increases the ability of the immune system to attack and kill tumor cells. There are some present challenges associated with this research area. Nowadays, immunotherapy is being explored more and is being utilized for various different types of the cancers. So the efficacy of there is need to explore further the predictors, or we can say the markers that can predict the efficacy of the immunotherapy. So when there is introduction of the immunotherapy to any patient, then immunotherapeutic drugs can show some types of the immune-related adverse events. These adverse events may be mild to moderate or the severe. These mild to moderate adverse events can be controllable, can be easily monitored, and it can be easily treated. But there are some adverse events which are very severe, like pneumonitis and the enteritis. Such type of the severe immune-related adverse events may prevent patients from receiving further treatment or the routine preoperative care. So there is need to study the predictors, or we can say the markers of the markers that can predict the efficacy of the immunotherapy. So there is necessary of the further research in this area. On this ground, this study has designed two different objectives. They have analyzed the relationship between the occurrence of immune-related adverse events and the pathological outcome. They have explored the pathological outcome like pathological complete response and the measured pathological response. Further, they tested that whether these immune-related adverse events could act as a prognostic factor to predict the efficacy of immunotherapy. Coming to the methodology section, in this study, they have included patients with resectable stage 2B and 3B non-small cell lung cancer without previous anti-cancer therapy and EGFR ALK mutation. Also, the included patients were with the measurable disease and their pre-treatment tumor tissue was available. This tumor tissue was used to assess the expression of the PD-L1. This study was conducted between the period December 2020 to March 2022. Coming to the trial design, in this trial they have designed a introduction of the neoadjuvant toripalimab every 3 weeks. They have decided a cycle of 21 days, and they have introduced this intravenously toripalimab up to 40 mg dose, plus along with the double platinum-based chemotherapy. After the completion of the 6 to 8 weeks of the commencement of the toripalimab, they have conducted the surgical resection for some selected patients. In this study, they have assessed some characteristics of the patient, such as age, sex, pathological type, history of the smoking, tumor node metastasis stage, occurrence of the immune-related adverse events, and the residual viable tumor. The primary endpoint of this study was to assess the major pathological response, that is MPR. MPR means the presence of less than or equal to 10% of the residual viable tumor after the given or the selected treatment. Also, they have assessed the secondary endpoints such as emergence of the immune-related adverse events, pathological complete response, that is the complete absence of the residual viable tumor. Then they have also assess the tumor burden, that is objective response rate, then R0 resection rate, perioperative safety, and the event-free survival. Coming to the results section, on the basis of findings they have obtained, the age of the patients, the median of the age of the patients was 61.5 years old. In this study, they have included 55 patients. Out of these 55 patients, 50 were male and 5 were females. The ratio of male to female was 10.1, whereas 49 patients had the smoking history. The staging of the disease indicated that 16 patients had the second B stage of the disease, 31 patients had a third A, and 8 patients had the third B stage of the disease. Further, they have assessed the staging of the lymph nodes, whether the this cancer has spread to the nearby lymph nodes. And they have observed that 9 patients do not have any metastasis to the lymph nodes, whereas 16 patients had the N1 stage and 30 patients had the N2 stage. Further, the pathology of this type of the cancer indicated that 44 patients had the squamous cell of the carcinoma, 9 patients had adenocarcinoma, and 2 patients had the adenosquamous carcinoma. In the methodology section, we have already seen that they have introduced the toripalimab every after 3 weeks. Here is the details of how many patients received how many number of the cycles of the neoadjuvant toripalimab along with the chemotherapy. Only 2 patients had completed 1 cycle of the neoadjuvant toripalimab. After 1 cycle, because of some treatment-related adverse events, they have discontinued the immunotherapy. Then 38 patients completed 2 cycles, 14 patients completed 3 cycles, and 1 patient completed the 4 cycles of this toripalimab along with chemotherapy. There are some treatment-related adverse events were observed in this study. Almost 53 patients, that means 96% of the patients were exhibited some types of the treatment-related adverse events like myelosuppression, vomiting, nausea, hepatic function impairment, and etc. Among these 17 patients, that is almost 31% of the patients suffered from the grade 3 to grade 4 treatment-related adverse events. In the last slide, we have seen that 2 patients were discontinued with the after the 1 cycle of the immunotherapy. Out of these 2 patients, 1 patient discontinued due to bile tract infection, and another patients were discontinued due to the enterititis, which is immune-related, severe immune-related enterititis. So these 2 patients can't continue with the immunotherapy. There were 20 patients, that means 40% of the patients were diagnosed with the immune-related adverse events. And here is the details of these 22 patients. Out of these 22 patients, 12 patients had diagnosed with the hyperthyroidism, that is thyroid dysfunction. And in this trial, they have also assessed the median time of the occurrence of the immune-related adverse events after the commencement of the toripalimab. And in this case, these 12 patients, those shown the hyperthyroid dysfunction, their median time interval of the diagnosis of the immune-related adverse event after the introduction of toripalimab was 45.5 days, whereas the mild type of the immune-related adverse events, that is rash, occurred in 7 patients, and their median time interval was 8 days. Then severe immune-related adverse events, that is enterititis, were seen in 2 patients, and the median time interval was 45 days. And pneumonitis seen in 1 patient, and the time interval was 62 days. Further, they have compared the time interval between the commencement of toripalimab and the diagnosis of different grades of immune-related adverse events. In the last slide, we have seen that the more severe adverse events, that is pneumonitis and the enterititis, occur almost 42 days and 62 days of the commencement of the toripalimab. And here they have compared the occurrence of grade 1, 2, and 3, and they have observed that grade 2 and grade 1 type of the immune-related adverse events that occur before the occurrence of the grade 3 types of the immune-related adverse events. In this study, they have included 55 patients, and 55 patients received the neoadjuvant chemo-immunotherapy. Out of these 55, 6 patients failed to accept the surgery. Because 3 patients difficult to receive resection, 1 patient reported with the immuno-related pneumonitis, so he discontinued, and 1 patient had the poor progression survival score, and that patient cannot endure the surgery. Whereas 1 patient had the good significant clinical response, so he decided to wait and watch a strategy instead of going for the surgical resection. So total 49 patients received thoracic surgery. Out of, again, 1 patient was excluded from the final analysis because that patient underwent thoratoscopic exploration due to the difficulty in R0 resection. So in the final analysis, they have included 48 patients, those underwent R0 resection. Here is the details of 48 patients, those received R0 resection. And also they have described the median time interval between treatment and the onset of immune-related adverse events. We have already seen that 11 patients were reported with the hypothyroidism, and they have calculated the pathological outcome, that is pathological complete response and major pathological response in these patients. And out of these 11 patients with the thyroid dysfunction, 5 patients achieved pathological complete response and 6 patients achieved major pathological response. Whereas the mild type of the immune-related adverse events, that is like rash, occur in 7 patients, and out of these 7 patients, 5 patients achieve pathological complete response and 6 patients achieve major pathological response. Whereas the patients with enterititis achieved the pathological complete response and major pathological response. Then in addition to this, the researchers have performed the pathological response, comparison of the pathological response for different clinical stages of the non-small cell lung cancer. And they have observed that stage 2B and 3A might benefit mostly from the neoadjuvant immunotherapy. And there were no significant differences found between the clinical stage and the pathological response. Further, they have compared the waiting time after the last cycle of the immunotherapy between early onset, late onset, or the no occurrence of the immune-related adverse events. Here they have observed non-significant difference between these categories, and this further confirms that the occurrence of immune-related adverse events would not delay surgery. So the commencement of the immunotherapy is safe in these patients. After the surgical resection, some patients underwent adjuvant therapy. Out of 48 patients, those were included in the final analysis. 34 patients did not take any adjuvant therapy, whereas 14 patients took adjuvant therapy in the form of like chemo-immunotherapy with and without sequential immunotherapy for the maintenance treatment, or some patients received directly adjuvant immunotherapy. Finally, they have performed the event-free survival by early or late onset of the immune-related adverse events in all 55 patients. And this survival analysis indicated that we already seen in the slide in the result section that 33 patients were without immune-related adverse events. They have reported with the treatment-related adverse events, and the average event-free survival time for these patients was 22.7 months. Whereas the median event-free survival of the 22 patients, those reported with the immune-related adverse events, was 23.5 months. Out of these, all the patients, 6 patients arrived at the endpoint of this study. 3 of them had encountered local recurrence of the disease. 2 of them had been diagnosed with the metastatic lung cancer, and 1 patient died during the study. The patients with early onset and the late onset, the autosol movement between these patients was 3 months. And we have seen that 14 patients were with the early onset of the immune-related adverse events, and 8 patients were with the late onset of the immune-related adverse events. So on the basis of all these findings, the author have suggested that the early onset of the immune-related adverse events can serve as a predictor of the better outcome among these patients after the commencement of the neoadjuvant immunochemotherapy. So the early onset of the immune-related adverse events are mainly the mild to moderate type of the adverse events like rash or the thyroid dysfunction. These adverse events can be easily monitored, or they are easy to control, or they can be easily treatable during the pre-operative treatment period. So such type of the immune-related adverse events can be used to predict the positive treatment outcome in the patients with the advanced stage of the disease. This study has some limitations. This study was conducted at a single center. It is not a multi-center study, so the findings cannot be generalized. Also, this study was not a randomized control trial, so there is some selection bias. Also, in this study, the patients enrolled they were in the preparation for the lung cancer surgery. So this can introduce the selection bias. Also, this study conducted with the 55 patients. So this was a limited sample size. The major limitation of this study is that they have considered only one type of the immune checkpoint inhibitor, that is toripalimab. There are various different types of the immune checkpoint inhibitors that is being studied and that is being utilized in the patient of the non-small cell lung cancer. But this study was conducted only with the toripalimab. So there is need to conduct such type of the study with the other types of the immune checkpoint inhibitors, because every immune checkpoint inhibitors can reflect different types of the immune-related adverse events. Also the time of the occurrence or the time interval of the occurrence of these immune-related adverse event may be different for all different for the other types of the immune checkpoint inhibitors. Finally, the author have concluded that such type of the immune-related adverse event, that is mild to moderate type of the immune-related adverse events, can be the indicator of the positive treatment effect, which may not be affected by the treatment cycle. So given the potential for positive impact on the treatment-related outcomes, so if the precise identification of such type of the immune-related adverse events can be done, that this can be helpful to assess the efficacy of the immunotherapy in patients with the advanced stage of the disease. This research has impact on the use of the immunotherapy, because immunotherapy is nowadays widely recommended as a first-line therapy for advanced lung cancer disease. So there is need to explore the efficacy of the immunotherapy in such type of patients, because if there is early onset of the immune-related adverse events, then there is easy to predict the efficacy of the immune checkpoint, efficacy of the immunotherapy, or the efficacy of the immune checkpoint inhibitors like toripalimab. So this piece of the research offers insight into future prospectus for the prediction of efficacy of immunotherapy. Thank you. Thank you so much for your patient listening. You can find me at yogita@trainings.org.
Thank you, Yogita, for this very informative talk. Now I would like the audience for questions. So Vijay asks, what was a specific immunotherapy used for all patients or was it different?
They have used only one immunotherapy drug, that is toripalimab, in all the patients. Only the difference that some patients have discontinued. We have already seen in the result section that 2 patients were discontinued after 1 cycle of the immunotherapy, whereas some patients have completed 2 cycles, some patients have completed 3 cycles, and some patients have completed the 4 cycles of the toripalimab.
Thank you, Yogita. I hope it suffices your doubt, Vijay. Nupur asks, why immune-related adverse events are observed mostly in grade 1?
Okay, yeah. Actually, there are 2 different types of the immune-related adverse events. Some are the early onset or some are the late onset. The most common mild to moderate type of the immune-related adverse events, that is like a rash, that is being observed in most of the patients, whereas some patients have reported the pneumonitis and enteritis, which is more severe immune-related adverse events, but they occur at the late onset and they also occur in the very less number of the patients. As compared to the mild to moderate type of the immune-related adverse events, and this may be the one of the reason why they have focused on the adverse events as a predictor for the immunotherapy.
Okay. Nupur's second question is, why hyperthyroidism observed? Is it due to the particular inhibitor?
Actually, they have not described the reason why they have observed the hypothyroidism or the thyroid dysfunction in such number of the patients, because it is almost observed in 11 patients out of 55 patients. There is not such reasons observed, but it may be the associated with the type of the immune checkpoint inhibitor that they have used, that is the toripalimab. They have not described, they have not discussed that point in the discussion of this paper, but there may be some reasons why why in so many number of the patients thyroid dysfunction seen in the toripalimab. There is one more reason that most of the patients were with the advanced stage of the disease. This may be the one of the reason behind this.
Thank you, Yogita. Numair asks, did the authors offer any biological reason behind hyperthyroidism as the adverse effect?
Actually, they have not discussed these findings in the discussion of this paper. They have not listed. They have not listed out any reasons why the thyroid dysfunction has occurred. But as I have already told, that there may be the reason that the most of the patients were with the advanced stage of the disease. So this may be the one of the reason behind this.
Okay, thank you, Yogita, for answering all the questions. That is all. Can you please move to the last slide? So before concluding today's session, I'd like to inform you about our next session, which is on the 23rd of August 2023, to be presented by Dr. Divya Lakshmi on the topic Artificial Intelligence-Based Prediction of Lung Cancer Risk Using Non-Imaging Electronic Medical Records, Deep Learning Approach. So that brings us to the end of our Cell Talk webinar today. Thank you everyone for your kind attention and time. Hope to meet you at the next webinar. Thank you.